Ah, the sounds of springtime allergies, right? Trees and flowers are starting to bud, and if you have allergies at this time of year, you can feel it. And if you are suffering, you are far from alone. I'm joined today by Dr. Rachel Haley of the Lee Summit Medical Center. Thank you for stopping by as she continues to poke her own eyes here. You're a spring allergy sufferer yourself.
I am.
You can relate.
In the door. Yes, those pear trees.
How common are allergies at this point?
More common than you think. This year, in fact, 35 million Americans are destined to suffer from allergies this year.
Is that more than usual?
It's starting to rise, I think. And one of the biggest myths that I hear all the time, patients think that just because they never had allergies as a child, that they can't get them as an adult. And in reality, it's really common for that to happen.
I had late adult onset allergies, but mine more so in the fall. You know, it's kind of picks and chooses, it seems like. Okay, so let's talk about there's no cure, sadly, right?
No,
anymore.
But
I hear
cure.
Friends going to a doctor for allergies, an allergy doctor. When do you know that's you?
Well, you know, we most commonly prescribe over-the-counter medications for allergies, things like antihistamines, decongestants, nose sprays, allergy eye drops, but for really severe allergy sufferers, sometimes they need allergy shots. So I always tell folks, if you're willing to undergo a weekly or every other week shot for years at a time, then you might be ready for allergy shots.
And that can make a difference.
It can, definitely.
All right, so let's talk about this weird time of year too, where we're also coming sort of off of cold season, but a lot of these symptoms kind of look alike. How do we know the difference?
Yes, that's a great question. We are at the tail end of the cold season, but there are some differences that we can look at. You know, a cold is caused by a virus, but allergies are an immune response of your body to these triggers, allergens. So, but there are the differences. A cold often will have watery eyes, but not itchy eyes like allergy sufferers will. But they will have some commonalities, you know, the runny nose, the congested
they're very
nose.
similar. If you look at this chart,
Yes.
there's a lot of yeses in both sides of
Yes.
that list. Isn't that funny?
It is true, but cold will have a fever, and allergies will
never
have
have a fever.
that. And
Okay.
allergy eyes will, you know, itch. So, and common colds don't often have that. But one of the biggest ones that can tell a difference is duration of symptoms. So, colds rarely last longer than 2 weeks, but allergies can last as long as you are exposed to the substance that's triggering the response, and that can be weeks to months.
Yeah, and some people year round, it goes from
Yes.
one allergy to the next. Doctor, thank you so much
You're
for
welcome.
stopping by. I know you have some recommendations on what to do if you're an allergy sufferer, things to do. If you want more advice from HCA Midwest Health, you can find it on our website. Just go to kctv5.com/HCA Midwest.